Thanks, Ceann Comhairle. The purpose of the motion here tonight, Minister, is to try and find out exactly the purpose of the budgetary estimate last year and its implementation from there on out. And if you look at the statements made last year by the Minister for Health and other ministers in the context of the formulation of the budget, they were accepting there were going to be very challenging and difficult times ahead. Of course, at the time we did highlight that we were very concerned about the budgetary process, about the amount of leaks and sort of intimidationary statements made by ministers to their various colleagues, that Armageddon would arrive at the scene if they didn't get their way at Cabinet. But what is quite clear 7 months on from that budget is that a lot of it was a tissue of lies in terms of the health estimate, Minister. Because quite clearly what happened and has transpired since is that budget was based on a false premise, and on many false premises if you look at it. In the context, for example, the restructuring of the HSE, we were told in the programme for government that it was a priority of this government. The Minister for Health, one of his first acts, he was like White Earp going down to the OK Corral, looking for a fight, picking a fight, and he found the board of the HSE. He summarily dismissed them and replaced them with another interim board. And we asked at that time, what was the purpose in dismissing that board? And he said that he wanted to be a hands-on minister, a minister that would roll up his sleeves and take charge of everything. Well, unfortunately, today in the Dáil, we're still waiting to see that legislation. We're still waiting to see the governance legislation in terms of changes to the HSE. And that in itself, Minister, has created huge difficulties, because there's now paralysis, absolute paralysis, in the HSE and the Department of Health. Nobody's quite sure of who's in charge. The Minister says he's in charge, that he's responsible, but he's absolutely abdicated his responsibilities. The CEO, Cathal McGee, was before an Oireachtas committee quite recently, and he outlined quite clearly that there was no way that they would achieve the savings that were outlined in the budget last year. That there was no way they'd achieve those savings. So the savings that were outlined last year were figments of imagination, in my view. And it has transpired that that is the case, because we're now running at a budget deficit of over €280 million already. And there will have to be huge changes and catastrophic damage done to the services if you have to come in on target. And we have highlighted this in January, February, March, April. Every month we've highlighted that the budget itself and the figures that were given last year were not achievable. And what we will see now, Minister, later on this year, is we will see huge damage and dislocation to services. We will see closure of theatres, downgrading of wards. Even as Cathal McGee, the CEO of the HSE, said at a committee, we could see potential closure of hospitals themselves to bring in on budget. So what I'm saying here quite clearly tonight, and the motion states it, noting that the health estimate in budget 2012 was misleading, given the fact that it was based on assumptions and targets that were not deliverable by the Minister for Health. Another key area where you said you would make huge savings. The figures are there, but nothing has happened in reference pricing and generic drug substitution. And there has been no effort in bringing forward legislation to enable you to go into generic price fixing and reference pricing. There's been no legislation brought forward. And that again was a priority stated in the budget as an absolute to bring about the savings required to bring the HSE in on target. So quite clearly that is another area where you effectively have absolutely failed in terms of priorities and making sure that you had a budget that you could stand over. Of course, the whole other area where you said you would make substantial savings as well was in the area of private health insurance and charging the full cost of public beds. Again, no enabling legislation, no changes. So in those two areas alone, your budget will be out about 200 million because of your failure to even bring in the legislation that you committed in this House last year to make sure that the HSE would have an adequate budget to deliver the services. But what will happen now is we'll have fire brigade action September, October, November, slash and burn, and all because you were incapable of bringing forward the priorities and the policies that were outlined by the Minister for Health and the Minister for Finance in the budget last December. So here we are now in July. The HSE is still in a state of flux. The CEO is the accounting officer. The Minister claims he's in charge. The board is made up primarily of people appointed from the Department of Health. The Department of Health say that it's the HSE are responsible, but yet the board and the CEO are is the accounting officer. So in just terms of that, that has brought about huge damage and dislocation in trying to bring forward policy enacted and making sure that services are provided. When you looked in at the HSE service plans, the Minister again last January, more smoke and mirrors in terms of, sending back the service plan, that he wasn't happy with it. Sure, I mean, he should have been involved in drafting the service plan. He claimed quite clearly that he was the one that was ultimately responsible. So the HSE and the board, they sign up and sign off on a plan. The Minister has one hour look at it and sends it back to the board again, saying that he wants substantial changes. Now, I'd like to know, Minister, what were the substantial changes? Because in my view, there was no changes made. There was no changes made. This was another spin effort by the Minister to show that he was flexing his muscle in terms of being in charge. But unfortunately, to date, he has not stood up to the task of being responsible in terms of making sure that the HSE brings in its own budget and on time and within limit. Because again, this goes back to one fundamental issue, the delivery of services to people. And we've already started to see that hospital managers are under huge stress and pressure. We've had claims that they're moving trolleys out of the counting area and up towards to reduce the trolley count. We've had cases where eminent consultants have said there is now lives being put at risk. We've had frontline health service providers and nurses stating that they are now working in areas that are just not fit for purpose in terms of delivery of emergency care. And all that's being said on a continual basis. But it's not new, Minister. It was said last December as well. And we highlighted these issues on a continual basis. Yet the Minister for Health seems to be incapable of either listening or understanding or acting on what has been warned. But it is time that he acts now, because his CEO of the HSE has said quite clearly that they will not and cannot come in on budget unless there is massive dislocation done to health services in the country. And this is the 7th month of 2012. So there will be huge adjustments required if you are to come in on time. And those adjustments are now, unfortunately, going to fall on vulnerable people. We had a situation not long ago where they were counting the incontinence pads in a nursing home in Kilkenny, actually counting the number of pads they were giving to elderly incontinent people. And yet at the same time, the Minister has failed in the fundamental saving schemes that he proposed, which was agency staff, generic substitution, price referencing. They were the 3 key areas where they identified massive savings to be made. And the CEO has said quite clearly that they haven't been realised at all. They haven't been realised at all, Minister. Now, I understand the difficult challenges that are out there. And we all know the reality of the situation that we face. But the very least one should do is to try and bring forward the legislation that will allow you to make savings, that will allow you to substitute with generics, that will allow you to price reference, that will allow you to address the agency issue. But more importantly as well, that you will bring about proper corporate governance and accountability at the highest levels to make sure that government policy is enacted. And that is not happening by any stretch of the imagination, Minister. We then move to the whole issue of community nursing homes. The Minister stated that the most important thing with regard to acute hospital services is to make sure there's a throughput of patients, that we don't have people who are in intensive care units or in high maintenance units in hospitals when they could be out in the community nursing homes. And in the same breath, the service plan that he rejected initially and then sought to amend has closures of over 800 community nursing home beds. 800 beds in 1 year. Now, Minister, that is, with any stretch of the imagination again, contradictory to what the Minister is trying to achieve, which is to take people that shouldn't be in hospitals into a community setting. Now, I never come into this House and question anybody's integrity, but other deputies have raised the issue of about conflicts of interest in terms of private nursing homes and support for private nursing homes, and at the same time, a slash and burn of our community nursing homes throughout the country, without any logical explanation as to why these nursing homes should be closed. You use HICWA in some cases, in other areas you use other reasons for closing them. But there is a fundamental question that we all have to ask. What is the logical reason behind closing community nursing homes, which we all accept and everybody knows gives the highest standard of care to our elderly people in the community setting, and which would benefit in every way the transfer of people from a hospital setting to a community setting, which is what the Minister says is a stated policy. And at the same time, he reverts to type and closes them without any consideration to either the residents or the community themselves. We looked in at other areas that are causing huge dislocation. The Minister has made great store about his special delivery unit. This was the answer to all his difficulties. This was going to resolve the problems facing. I'll tell you what the special delivery unit is doing, Minister. It's spending an awful lot of time dealing with people who are waiting over 1 year for procedures. But what it's not doing, and what it's benefiting from, is that people can't get to see a consultant to be assessed to find out whether or not they will need to become inpatients. There are hundreds of thousands of people waiting at the present time to see a consultant, just to be assessed. And they're not being allowed into the system. I have people who are waiting over 4 years for an audiology assessment. Over 4 years. The woman is in her 90s, Minister. We have people waiting for ages for orthodontic services. It is shameful what is happening in terms of orthodontic services, and particularly to our younger people, where they simply cannot see an orthodontist. So look, Minister, we have to be honest with ourselves here. You failed to bring forward the legislation that would allow you to deliver the services that our people need. I don't know why or what the reason is, but the Minister promised, as I said, those 3 pieces of legislation. He also promised, with great fanfare some time ago, that he would negotiate consultant contracts. Has just thrown it aside. He says he might get more productivity out. He did before. At the same time, we have consultants who are continually in breach of their 20-80% ratio in dealing with public and private patients. Consistently in breach. And we have other contracts then where there's a 70-30 ratio, and they're even in breach of the 70-30 ratio. And nobody is taking them on. Now, he promised when he's on this side of the House that he would do the devil and all when he'd go to that side of the House. He's gone to that side of the House, but after that, it has almost stopped. And what I'm saying here quite clearly, Minister, you're in the seat tonight. You're as accountable as he is, because you are representing the government in this chamber, and you're representing the government in terms of a debate on a budgetary process. And quite clearly, ye have failed singularly. And when ye are closing hospital wards and theatres, and closing more nursing homes in the time ahead, you just might reflect on the fact that if he had been active in the legislative area to bring about the savings that were identified in the budget, that we wouldn't have to go to the drastic action that we may yet have to go to. So, Minister, what I'd like to hear tonight is, what exactly will he do at this late stage, 1 week of Dáil sitting, to bring forward legislation to allow you at least effect some savings between now and the end of December, so that we won't have the dislocation of services that is going to evidently happen if we continue on the same path as we're on. The issue of the accountability and the HSE. Like, Minister, we have to find out once and for all who we speak to. Is it the Minister? Is it the Secretary General of the Department? Is it the CEO? Or is it all 3? Is it you know, the 3 wise men? I mean, we simply have to know that. Because until such time as that issue is addressed, I see it at committee level, where you have the Secretary General, the Minister and the CEO, and they all deferring to each other. There has to be at some stage, a hands-on approach from the Minister on this. Now, with regard to the other commitments that were made in the programme for government, I mean, look, I only have 20 minutes, Minister, and it would be wrong of me to, you know, take up more time than that. But we will have to revisit the whole issue of primary care, for example. The allocation of primary care. The Minister promised at the IMO conference that he would transfer money from the hospital budget to the primary care setting. Has that happened? So, I mean, these are key questions that we have to know, because you cannot continually spin your way out of this particular one. The fact of the matter is that on a continual basis, services are being downgraded by stealth, and we will have people waiting for longer periods, not necessarily on the hospital trolleys, but to see a consultant themselves. They're just incapable of actually seeing a consultant for assessment. So, Minister, tonight is a night for us to highlight quite clearly your abject failure in bringing about and addressing the budgetary problems that have been evident since early January. As it was highlighted in terms of the private health insurance and the fact that the charges to public beds would not happen. The CEO just said only last week that this didn't transpire at all. So in one foul swoop, he lost millions by inactivity on the legislative front. And as I said, people will suffer because of that. Councillor Corley, how many minutes have I left? 4.5 minutes left. Thanks. On the issue of agency staff, Minister, we did highlight at the time that you didn't have a plan in terms of the retirements on the 29th of February. And the more I look at it, it is by pure accident rather than design that we didn't have a worse dislocation to health services. But we also have another issue now with regard to agency staff, the Temporary Agency Workers Directive. And a key component again of your budget was to address the reliance on agency staff. And in your budget statement, you're saying you're going to save over 50%. Now, you have made no effort. The recent figures from the HSE or from the Minister or from the Department, I'm not quite sure, but they come from somewhere, I presume that they're accurate, states that the agency bill has actually increased. So here we have a situation where we're becoming more reliant on agency staff, even though it is a stated policy of the Department of Health and in your budget statements last year that this issue was to be tackled and that you were going to address the issue of agency staff once and for all. So on many areas, Minister, I hate to say it, but after a short period of time, you have absolutely driven the health services to the point, because of inactivity. It is not always necessarily a lack of funding, but inactivity, a deficit of ideas, a deficit of action, more so than a deficit itself. And that is the situation that we face ourselves in. So all I'm saying here, Minister, tonight is, when people are waiting longer periods to be assessed, when people are waiting longer periods to get the medical card, when people are waiting longer periods for orthodontic treatment, when people are waiting 4 and 5 years at 90 years of age for audiology services and assessments, you can just look back and look at your failure, your absolute failure in bringing forward the legislation that you promised to the people and as importantly to this Dáil when you passed that budget last year. Because I am convinced, and it was said at the time, it was aspirational at best, or it was dishonest at worst. And I'm still holding jury on that particular one. So, Minister, it gives me no joy in staying here tonight, and let it be conveyed to Minister Riley as well, that it is a very serious breach of trust when you bring a budget through and then fail abjectly to bring forward the legislative measures that would bring about the savings so that people who require services will not be the ones that will have to carry the burden for inactivity and your failure.